Hello everyone, welcome to another essay revision session under the Medicus Academy, Zambia. In today's session, we are looking at identifying nursing problems and formulating nursing diagnosis. I will take you through practical steps, the NADA format, and an example you can use in assignments and exams. I'm your presenter, Gift Shrem. By the end of this talk, you will be able to number one, explain what a nursing problem is, perform the three-step process to identify these problems, and number three, formulate a nursing diagnosis using the NADA format. Let's move on. So to start with, we are defining nursing problems. So we are saying a nursing problem is a patient's health issue that nurses can manage directly. Identifying these problems correctly guides focused, effective nursing care and improves patient outcomes. Let's now look at how to identify these nursing problems. So there are three main steps. Number one, assessment. Number two, data analysis. Number three, problem identification. So let's look at each step separately. You start with thorough assessment where you collect patient data. This data can be objective data or subjective data. Subjective data, this is what the patient says. Objective data is the observations you make on this patient or this client, the vital signs and the tests that you do. When collecting this data, use open-ended questions, active listening, and focused exam. Confirm inconsistent information by rechecking or re-asking the client or the patient or their family members if appropriate. A good assessment prevents misdiagnosis. Now that you have collected this data, you now analyze the data. So now you group and analyze the data that you have collected. Look for abnormal values, clustered cues, trends, and contradictions. Ask which findings are unexpected, which ones are related. This is where you separate the normal variations from the real problems by looking at the patterns as you group the data that you collected. For example, if you find low mobility and the patient reports pain and reluctance to walk, group these together. They likely point to a single underlying issue such as impaired mobility related to the pain which the patient has said to experience. Now we move on to problem identification. From your analysis, decide the specific nursing problem that needs nursing interventions, because not all issues the patient comes with needs nursing care. The problem should be something nurses can address directly, and it should be stated clearly and concisely. Now let's move on to formulating our nursing diagnosis. So for you to formulate a nursing diagnosis, you need to use the NADA format, which is the North American Nursing Diagnosis Association format. So this format says we need to have our problem first, then you look at the etiology and the evidence. So in this case, looking at our example, the problem or the nursing issue that you have identified is the impaired mobility. That is what's wrong with the client or patient. Okay, and what is the cause or the contributing factor? We are saying it's pain, which is our subjective data that we collected. Then the evidence is difficult in walking, which is our signs and symptoms. So that's how you formulate a nursing diagnosis using the NADA format. Avoid the following mistakes when writing or formulating a nursing diagnosis. Number one, starting a medical diagnosis instead of a nursing problem. Number two, omitting evidence. Number three, using vulgar terms like risk or feeling bad. Ensure that you use commonly used medical terms. Number four, mixing multiple unrelated problems into one statement. And as we close our session today, I'll close with one practical tip for exams and assignments. In exams, follow these steps quickly Assess the question, highlight cues, group related findings, choose the nursing problem and write the NADA statement with clear evidence for you to get the required results or marks. Practice with sample cases to build your speed. We end here as Medicus Academy Zambia. Thank you very much for listening. See you in our next session.